This is the 6th video in a series of videos on glaucoma training. Module 6, Risk Factors for Glaucoma. People with glaucoma don't usually experience symptoms until the disease is advanced and there is a considerable loss of visual field. However, the risk factors are well established. During an eye examination, you can investigate a number of risk factors that will help you to establish the likelihood of your patient developing glaucoma and enable you to use your clinical judgment to establish an appropriate level of monitoring, treatment, or referral. The learning objective for this module then is to know which are the various risk factors for glaucoma. A reflection point. A 50-year-old lady attends your clinic because her vision has deteriorated. In addition to refraction, what tests do you routinely perform in your normal clinical setting? Identifying risk factors. Anybody can develop glaucoma, but factors that increase the risk include age, race, family history, and intraocular pressure. Glaucoma has a multifactorial etiology. Both genetic and environmental factors can contribute. Identifying which patients are at risk of glaucoma can positively influence appropriate levels of investigation and clinical management of glaucoma suspects. Subsequent monitoring gives the opportunity to diagnose and treat glaucoma from an early stage. So what are the main risk factors? Age. The risk of developing glaucoma rises significantly as you get older, both in its own right and because it is associated with other age-related diseases. For primary open-angle glaucoma, POAG, around 2% of the population will develop the condition over the age of 40, rising to 10% over the age of 75. Increasing age is also a risk factor in primary angle closure glaucoma, PACG. Race. The prevalence of glaucoma differs depending on ethnicity. Black African and Black Caribbean people are between 4 and 8 times more at risk of developing primary open-angle glaucoma compared to white people. It's more likely to develop at a younger age and a faster rate. Being of East Asian origin can increase your risk of primary angle closure glaucoma, with over 80% of those with primary angle closure glaucoma found in Asia. The highest prevalence rates of angle closure glaucoma were reported in Japan, 1.19%, and China, 1.1%, compared to 0.4% in European-derived populations of those 40 years of age or older. Understanding the impact of ethnicity on glaucoma type and prevalence is important to improve your individual patient care. And glaucoma as a secondary risk factor. The increased risk of glaucoma in certain ethnic groups is in some part linked to the higher prevalence of other diseases which have a secondary glaucoma link. For example, type 2 diabetes is up to 6 times more likely in people of South Asian descent and up to 3 times more likely in people of African ethnicity. Myopia is also much more prevalent in people of East Asian ethnicity, and so the associated risks of myopia and glaucoma become a secondary risk factor. Family history. The risk of developing glaucoma is between 4 and 9 times more likely if a close blood relative, such as a parent or sibling has the condition. It is, at least in part, a hereditary condition, and the risk increases the closer the relative, i.e. if the person who has glaucoma is a sibling rather than a parent. Probing to find out at what age the family member was diagnosed, what treatment they received, did it come on suddenly, or was there eye pain, as well as whether they went blind, can all provide vital clues about the type of glaucoma and its severity. Refractive error. Genetic factors are known to affect the likelihood of developing glaucoma in some cases. For example, high myopia can increase your risk of developing primary open-angle glaucoma, and primary angle closure glaucoma is more common in people with hyperopia. Medical history. Many of those at risk of glaucoma will already have other chronic systemic conditions. The following have been associated with an increased risk of developing glaucoma: cardiovascular disease, vasospasm, systemic hypotension, and diabetes. Other factors with medical history. The use of certain drugs, particularly steroids, is linked to an increased risk of developing glaucoma. Acute incidents, such as an eye injury, inflammation, or surgery, can also increase the risk of traumatic glaucoma, which can happen immediately after injury or years later. A reflection. How much time do you spend effectively questioning patients to gather information? Would it be useful to develop your questioning skills to increase the relevant information gathered from some patients? Do you consciously use both open and closed questions, and understand why? Having a thinner central corneal thickness, CCT, is considered a risk factor. In the ocular hypertension treatment study, it was found that CCT is a risk factor for developing glaucoma, independent of intraocular pressure, and those with a reduced central corneal thickness, less than 555 micrometers, have an increased risk of developing glaucoma. Central corneal thickness can also impact on the accuracy of IOP readings. Where the cornea is thinner, it is possible to underestimate intraocular pressure, where a thicker cornea creates a tendency to overestimate intraocular pressure. Here is an anterior segment OCT image with measurements of internal anterior chamber diameter, anterior chamber depth, and corneal thickness, as depicted by the green lines. Raised intraocular pressure is one of the most significant risk factors. Currently, 1 in 5 people with ocular hypertension goes on to develop glaucoma. It is also the case that the higher the pressure, the greater the risk. Lowering IOP is currently the best way of preventing or controlling the development and progression of glaucoma. While lowering IOP does not always stop progression, the ocular hypertension treatment study has shown that taking steps to lower IOP reduces by half the number of primary open-angle glaucoma suspects who go on to develop glaucoma within 5 years. The upper limit of statistically normal IOP is generally accepted as 21 millimeters of mercury. However, it is also the most modifiable risk factor, and by lowering the eye pressure, you can significantly lower the risk of glaucoma. The table on the next slide makes clear the relationship between high IOP and the risk of developing glaucoma. The risk is 12 times more likely with an IOP of 22 to 24 millimeters of mercury and rises to 40 times more likely with an IOP of above 35 millimeters of mercury. The OHTS risk calculator gives a method for estimating the 5-year risk that an individual with ocular hypertension will develop primary open-angle glaucoma. Based on results from the OHTS and the European Glaucoma Prevention Study, the calculator may be useful for you to decide the frequency of tests and examinations and the potential benefit of starting treatment. The risk calculator takes into account various risk factors to calculate a percentage risk of developing glaucoma. It requires the measurement of established risk factors: age, vertical cup disc ratio, IOP, central corneal thickness, and the pattern standard deviation from a visual field measurement. It is designed to support your clinical judgment rather than replace it. Limitations and cautions. There is no guarantee that the predicted risk is accurate for individual patients. The predictions are more likely to be accurate for patients who are similar to the participants studied in the OHTS and the EGPS, and if the testing protocols for your patients resemble those used in these studies. The prediction models were derived from studies on the development of early primary open-angle glaucoma. It is not clear whether the models also predict the progression of the established disease or the development of visual impairment. The risk calculator can be found online at the OHTS website at the Washington University School of Medicine at the link on the slide. So when considering the risk factors for the two main glaucoma subtypes, primary open-angle glaucoma and primary angle closure glaucoma, the risk factors vary between the two. You should familiarize yourself with the differences, particularly in the case of primary angle closure glaucoma, which is less common in the African population. Risk factors for primary open-angle glaucoma, therefore, are ocular hypertension, increasing age, family history, particularly with a close relative, ethnicity, with onset at a younger age in people of African ethnicity, a thinner central cornea, myopia, diabetes, and systemic hypertension. And the risk factors for primary angle closure glaucoma: it's more likely in females at a 3-to-1 ratio. Ethnicity: East Asians are at a higher risk. Family history: a short axial length, hypermetropia, shallow anterior chamber, which is more likely in females, an increasing age, as the anterior chamber becomes shallower as the crystalline lens thickness increases, a small corneal diameter, and it can be induced by topical and systemic drugs or other eye surgery procedures. Now you will be introduced to two patient cases that you will be studying throughout this course. Here you will consider the risk factors for glaucoma in relation to each patient. Case Study 1. Name: Janet Smith, Age 72, ethnicity white European, family history mother diagnosed with glaucoma in her 70s, and a medical history none reported. Why is this information relevant? The risk of developing glaucoma is between 4 and 9 times more likely if a close blood relative such as parent or sibling has the condition. Janet's older age and her mother's glaucoma diagnosis might suggest a higher risk of Janet also developing glaucoma. Case Study 2. Name Richard Palmer, age 48, ethnicity Afro-Caribbean, family history mother has glaucoma, medical history none reported. Why is it particularly important to test Richard for glaucoma? Black African and Caribbean people are between 4 and 8 times more at risk of developing glaucoma compared to white people. It's more likely to develop at a younger age and at a faster rate. Richard also has a family history of glaucoma. So in summary, glaucoma is an insidious condition, so identifying glaucoma suspects in routine eye appointments is currently the best way of providing a timely intervention. Identifying risk factors will influence your approach to case finding and provide an opportunity to manage the condition before it causes significant vision loss. Make sure that you have achieved the learning outcome for this module, which is that you now know which are the various risk factors for glaucoma. If you have any questions, be sure to have them answered.